Hi to everyone. I know most of you, but some of you I don't know your faces. Thank you for the opportunity to talk to you today. And I'm going to just tell you a little bit about my research. And it's a little bit different to probably what you've all been hearing about, because I'm not in the exercise science area, surprise, surprise, but I'm in sort of that space in another way. So I've chosen some topics or some research projects that I think will be of relevance to you, regardless of whether it's not in exercise science. But I'm going to tell you a little bit about myself to start with. So the top puzzle, I like the puzzle that comes together, is I'm married with 2 teenage girls. We love to travel as a family. One's 22 and one's 19. I'm an avid dancer. You probably wouldn't know it, but I love to dance. That's my crew. We dance together. You could see variety of ages, shapes and sizes, but we come together because we really love being together and dancing and being in a community. So it's called Dance Dynamics, and we do things like bar, dance, tone, all those sort of things. And I do it about 4 times a week, scheduling it in before and after work and every other commitment. I've got a great picture up there of hiking. I love to hike and do lots of outdoor sort of hikes. And that's the most recent one. We did the overland track in Tasmania late last year. And that was really great. Susie's not here, but she did it straight after me. So we saw each other for a day, which was good fun. And I like to bake. Those people across in HS1 know that there's always treats that I leave in the coffee room, I guess, or kitchen. So there's always baking. And I love to roller skate. There's another thing that I often do with my girls around the street. So that's good fun.
Do you still have your old 1980?
No, I got new ones. Sorry, my stoppers had worn out.
Okay.
But they're exactly like that as well. So they're the retro ones. And then to complete the puzzle, I thought I'd tell you a little bit about my background. So it's, as I said, it's not in exercise science, but I've got a background in sport and recreation management, as well as sport management, as well as public health. So it sort of all comes together, and I work in that inclusion minority group space. And so it sort of comes together with what I like to do as well in both my professional and private space. So I do a lot of work with called communities, women, girls, people with disabilities, and recently I've been doing some work in the Indigenous space as well. So sort of brings it all in nicely. And that's what sort of keeps me going. I love, what I do because it is something I'm passionate about. Now, the other thing we're going to talk about is qualitative research. I know the last few weeks in all our seminars, we've done lots of quantitative research, even though I do both. I have done mixed methods. I do lean towards the qualitative methodologies, mainly because I love to chat to people. And I think by chatting to people and drawing out that information, you often get richer data. And because often in a survey, they'll just fill in what they feel like, but you don't know what it actually means. So I'm very much into the qualitative methodology. And I guess it goes hand in hand with that public health background that I've worked in the sector for about 25 years. So I forgot to say, I'm almost an accidental academic, because I never thought of being an academic. I always worked in industry. And then when I was doing my master's, I was asked to do some teaching, and I sort of got into that way. And then it was sort of a nice segue when I had my girls to do that sessionally and part-time. So I always say I was an accidental academic because I never looked for that. And I think that's why my research is still in qualitative research, because it gives me that opportunity to work with industry quite a bit, because of those networks as well, rather than sending surveys out. I like to feel and touch and listen and talk to people. So that's why doing the qualitative research. So there's a couple of methodologies up there. I've used most of them. the ones I'm going to talk about today are action research, phenomenology, I can never get that right, a bit of ethnography, and a new one called photo voice as well, that some of you might not be familiar with. But that's what I'm going to base my talk on today. Who's done qualitative research? Yeah, so good, great, some people. So the first one I'm going to talk about is basically a research study that sort of came out of my work at Sport and Rec Victoria. Previous to being an academic, I had some good contacts there, and often I would find that people would come to me and say, you know, can you come and do some training for us around disability awareness in sport or rec programs that we had. Because no one was actually doing that, and I'm going to show my age, but in the late 90s. You know, people were sort of a little bit scared to work with people with disabilities because it wasn't something that sport or recreation organisations were really keen on doing. So this project came about in 2018 when I got a phone call one day from the Minister's office at Sport and Rec and said, the Minister's got some leftover money. And you know that project that you always talked about when you worked here, how about you come and have a chat to the advisors and see what we can drum up? So I went in, knew the advisors, went in, and I basically took a proposal in for about, 30,000. They came back and they said to me, no, he's got much, much, much more than that. We want it to be bigger and better. And I said, what do you mean? I said, well, we can't give you a number, but go back and think about what it might do if you were to design something, you know, think blue sky, think anything. So I went back with a massive proposal to develop a website. I thought they'd scale it back. They didn't. They wanted this website designed. So basically, I went into the process of developing. The end product was going to be a resource for people with very limited understanding of working with people with disabilities in the sport and recreation area, particularly clubs and recreation associations. But to get to that, I was like, well, we need to find out what they need. There's no point just saying ad hocly, this is what we think as people who have worked in the sector. So phase one of the project in 2018 was very much looking at a narrative inquiry. A narrative inquiry is basically a research approach about understanding people's experiences, finding out what are the experiences of people out in the sector who have worked in sport and recreation organisations, and why haven't they included programs for people with disabilities in their clubs, in their organisations, and various places. So the first thing I did was do a desktop analysis, which was looking at what past training had been done in some of these organisations. So that's almost seen as an ethnography sort of study, because I went in and found out some information, looked at past manuals. I used to work at the YMCA, and the YMCA had quite a bit of information there that I could extract. Again, easy to extract because I worked there previously. So I knew who to go and talk to and where to get that information. And so that process started. Took about 6 months because there was a lot of information to gather and a lot of information to put into a database. At that time was SPSS rather than in vivo. So I put all that documentation in and started to paint the picture of what was needed, what were some of the gaps from what we were finding. And then during that phase as well, I developed some focus groups. Again, we had 5 focus groups with a number of 60 people. The focus groups looked at sport and recreation organisations, so quite diverse organisations from bigger sports like Football Victoria, which was FFV at the time, right down to, badminton as a smaller sport organisation. So we made sure we had a cross-section of people from sport and rec organisations. We also had another group for volunteers themselves, and we had people from being a president of a local soccer club who had never thought about developing programs for people with disabilities, right down to people who had started to do some work in that space. The biggest and most informative part of the process was having a group of people with lived experience of disability. So they could tell us what their experience was. I also had lived experience of disability. My brother had a disability, so I had cerebral palsy. So I was able to, bring in that expertise as well about what he went through as a family member as well. And then government departments were really important as well. One, because they were funding the project, but two, having other government departments who were going to then use this website to allow their organisations to use it as certified training. So it's actually a certified resource. And then, of course, we had to have designers because when you're putting curriculum together, or when yourselves, when you're developing videos, we're not the experts in that area. So I had a great design team, and they were called Glue Content. Still got the water bottle they gave me. So they were pretty much contracted to get together with us and design the process. So right from word go, it was very much grounded in research and finding out that narrative inquiry about what's lacking, what do we need, what needs to happen, rather than me going in and saying, oh, this is what we need to do. So quite extensive, and it took a whole year. And then we developed what was called an advisory committee, so that as we were going through the process, we could go back to this advisory committee, and there were 8 people, and it was 1 or 2 people from each of those other focus groups that we had. So we had, again, a pretty good representation of people that we could, again, go back to them as we were designing and developing to find out, was this working, wasn't it working, what should we do differently? So that was phase 1. And I initially thought it was going to take us only about 6 months, but it took us a good year because there was a lot of people who wanted to be engaged, a lot of people who wanted to be involved. And of course, with government departments, it always takes a little bit longer to get through things. So, again, that was important because they were the funding people. Then phase 2 in 2019 was when we started to design and put things in action and do lots of testing. And you'll see from the video, from the website that I'll show you in a minute, what I mean about videos and training and testing, because we actually then went out and developed vignettes, we developed videos, we developed training modules. So it was a long process. It's almost like we all know what it's like to develop a new course or it was exactly that. It was actually putting that into practice with this particular, and again, keeping in mind that this resource was developed for people who had a very base level understanding of working with people with disabilities or running programs for them as well. So there was a lot of testing going on. We were lucky to launch this with the Minister in 2020, just before COVID hit. But saying that, we had a great launch in February and then we went into shutdown. So, we had 2 years of it sort of ebbing and flowing. And as you can imagine, it was good, but people weren't using it as much as we would have liked to. But it also then, on the other side, we then got creative. Well, I got creative with the advisory committee and said, people are at home, so people could actually do this training. So then we released it to organisations and said, while your volunteers are not running programs, they might want to upskill in this area, and here's a free resource. So it's a free resource and accessible. So we found that once we did that, we had thousands of people take it up. We also then got people doing it internationally as well, which was really great to see that happening, because we get all that stats from behind the program. And one of the things that happened during that time when it went internationally was Quantara Sports in Dubai contacted me and said, we would love to use this as a resource. Could we establish an MOU and use it, translate everything into Arabic so that our volunteers and staff can use this? And then I did a few webinars for them online as well during COVID, which was fun, but interesting because I'm working with a translator and myself, because a lot of them, I don't speak Arabic, obviously. So I had to wait, speak, wait, and we went through that way. So they're still using that as a resource. And because they then started to think about, you know, we saw that there was a need for different languages. The website is now language specific to 12 languages. So then we did an extra update, and you'll see the last thing there, it says continuous update. It's always updated, you know, like it's one of those things with a website. It's something that I do probably every couple of months, add things, change things, recruit there, you know, put new material up there. So it's an ongoing process. And there is a little bit of money left over from Sport and Rec that I use in my outside earnings to allow for that to happen. So that's the process. And then this was the outcome. So this was the website. And I'll just, hopefully we can all see it. Don't know why that's there. Can they all see it on the? It's probably delayed. So you could see that we have various tabs, the courses which are certified. So organisations are using this now to get their volunteers to train in this area, because then they've got a certificate as well. So they're encouraged to do that. We've got lots of resources there where people could, you know, if they're a little bit stuck or need some information, there's lots of information there about what they can do. But in those bits of information as well, do you need Luke some? They could probably get it off the slides. Or I could share it later with them. Yeah. Is that easy for you?
How do you do that?
Share it and then share it with the internet.
Yeah.
You share, yeah. And then go share again.
Oh yeah, of
Oh
course.
yeah, and then go.
This one.
Yeah. Yeah.
Oh yeah,
There you
true.
go.
Should I just do that, because then we don't have to change back after? That'll be right.
So you can see there's lots of information there. And what I might do is just play one of the videos for you to see why it took us so long to put together. This was the Pararoos, an a group run by FV. We might not get sound now. Oh, sorry. So for that acceptance, we try to sometimes people have to things. So I think that's it. Going to be fun now, Luke. What do we do? Do I stop share? Oh, share here. Can you see that now? Yeah. Are they all good?
Yeah.
Yep. All right. So you can see that's just one example of, you know, an opportunity to put your research into practice, and then it's a long-term project. Again, it's one of those things that, you know, we often don't think about when we're doing our research, of actually thinking about how that translates into practice. But certainly for me, that's one of the most important concepts of my research, is actually putting it into practice, because essentially if I'm going to write an article and, you know, only academics see it, to me, I'd rather put more value into the industry as well as both academia as well. And I guess that's because I've always been interested in that industry environment as well. So I guess that's one project. Then, now I should reduce this, shouldn't I? So they can actually see that. Another project that I wanted to share with you today is one that I did with Melbourne City Football Club, the Community in Practice. So it's the charity arm of Melbourne City Football Club, where they run programs for people in various locations across Victoria, but they very much focus on sort of underprivileged communities and ensuring that some of the issues that are out in society, they try and use soccer as a vehicle to get people to address those sort of issues. One of the projects that they got some money from Respectful Relationships Australia was to develop a pilot program where they went into schools and used education and soccer to come together and look at things like masculinity, gender equality, understanding sort of those healthy relationships. And they particularly targeted the southeast suburbs, because Relationships Australia said that there were quite a few issues in the school system there the teachers were addressing. So they wanted to use soccer as a vehicle to explain to kids how they can be better at doing those sort of, and being respectful and having more healthy relationships. So they came to me and said, we're doing a pilot, but what we need to do is to evaluate. We want to see what the impact is across the year that we're running the pilot, because we'll want to be able to go back to our funders, but also other government agencies, and say, this has been the impact or not. They wanted to know whether it would work. So I came on board and did an applied research methodology, which basically looked at real life issue, which was what they were experiencing, and then looking at how do you find solutions for that real life issue and how does it work? So we use that methodology to basically look at a point 1 and a point 2 of the research study. So we collected data through semi-structured interviews, because a lot of these kids were quite happy to do it face-to-face, but not online. They preferred that rather than online. We did focus groups, and we also did, I went in and did observations as well. So while the program was going on, over the 5 weeks in a number of schools and a number of sport programs, I went in and viewed what they were doing and seeing any changes that were occurring over those 5 weeks. So lots of diarising and working out what was going on. It was also almost action research as well, because at the end of each session, I would then go back to the leaders in training, because they were young leaders learning the process, and say, you might want to think about doing it this way next week. This is why you're seeing this behaviour at this point in time. And so as they were going through the 5 weeks, they were also learning the skills to keep going on that program and get the outcomes that they wanted. So it was two-pronged there. So I interviewed, or there were 55 participants, so students between the ages of 10 and 18. And with ethics, that's often lots of fun trying to get consent for kids under the age of 18. But again, went through the process and that was fine. Lots of information. So prior to even doing this study, because a lot of the schools and sport clubs we were going into were from non-English speaking backgrounds, I had to go in and work with the club or with the school and speak to parents about what was going to be happening. And often that took 2 or 3 visits before I can even get consent for them to participate, for their child to participate in a focus group or an interview. So it was building that trust, that relationship that was really important for them to then open up to me about what was happening during the research. So it was, as I said, in the southeastern suburbs of Victoria, and we looked at a number of things. Again, it was a very small, it was 12 months, so I looked at it at the start, and then I followed up with all the participants 6 months later to see, was there any long-term, really ideally you're meant to do 12 months or more, but for this study, because it was only a pilot, we did 6 months to see whether the behaviour was retained. So the change did happen. What was the impact after 6 months? And then that was really good to then report back to Melbourne City about what were the impacts. And even though there were very small impacts, they were enough to say that that was an impact. There wasn't a massive amount of change. I think if we went back 18 months later, it might be a little bit different to see that, but we don't have that opportunity. So what happened was we rode together. I gave them the findings through a report. They launched it with some ministers who funded the pilot project down at Melbourne City in Cranbourne at one of the schools. And basically we gave them a summary. This is what they wanted. They didn't want, and unfortunately, sometimes with some of my research, you also can't publish, and this was one of them. So I couldn't write an academic paper, but of course there was a report from it as well, from it anyway, because there was, again, it was because of the underage kids that were being interviewed that they didn't want to expose in a research study. So the report sort of outlined some quotes, it outlined how it was done, it then came up with 3 key findings. You can see there was a shift in masculine attitudes. Positive peer influence was really important for a lot of these young people, that, you know, if their friends did it, they would do it. But if their friends weren't doing it, they wouldn't do it. So that peer relationship was really important. And so by week 3, we started to put that into the program for them to do in the classroom as well as through the soccer program, about how to, you know, if you see something, stand up and say that it's not good or incorrect, or so that was really important to put that into the research. And then also we did see improved relationships, particularly with girl-boy relationships, particularly with some of the participants who came from a background where there was very clear segregation of male-female roles, that even though that was what happened in their home environment, when they got to sport clubs or to schools, and hopefully that will translate as they go through this and get older, they started to be more respectful of different genders and different differences in people as well. And we started to see that, well, teachers particularly started to see that in the playground, started to see that in the classroom, where they wouldn't just say things like, oh, the girls can't play soccer with us at lunchtime. They would actually invite them to play. whereas previously they would say, no, you can't play. So there was all those attitude and relationship changes that did happen that we saw by doing the project. Teachers particularly, and some parents who we interviewed said that they started to see a change even in the way that they spoke to their parents. So that was really important, particularly, again, the male with a mum, perhaps, again, thinking of the southeastern suburbs and culturally diverse backgrounds. Mothers were often seen as just doing the housework and the chores and being, you know, not a leader in the household, whereas that started to change. Okay, and their attitudes started to change. You can see some quotes there. Before I get angry and shut people out, now I try to talk things through and listen to their side. That was a really big quote that came through and through a couple of times over and over of participants to say, now I stop and think, or I work with people rather than just yell and scream. And it's made a significant difference for the teachers in the classroom as well, because they then can actually teach kids what they needed to teach them, which makes it quite a lot easier for them. What has happened since this? City and the community have now gotten a 3-year project through one of the departments. I think it's Department of Housing, Safety and something else. They've changed names. And so now they're going to look at expanding the programs to other regions of Victoria, and then looking at me going in and doing more long-term evaluations as well. So from the pilot, it was really important for them to get that data to show there was a little bit of change and what they could do with having a more longer-term project to go with it. So, you know, I guess watch this space, just waiting to see what funding comes my way to run some more research. Because as I said to them, I do a bit of pro bono for them. I often sort of help out Melbourne City because of our past relationship when they were on campus here. But I said, not for a 3-year project. It's going to take a little bit more than just me doing that. So that's the second project. The third project, which I'm currently almost done, but started in 2022, is a project that worked with Called Women and Action on Disability within Ethnic Communities. Is ADEC is the organisation that got some money again from federal government, and they developed a project called Women of Colour. And then they wanted an evaluation of that. And essentially what the project was about was these women were not only from called backgrounds, culturally and linguistically diverse communities, but they were also carers of someone with a disability. So they were often quite isolated, often had major health problems themselves, but often put those on the back burner because they were caring for someone with a disability themselves. And it could have been a child or a spouse or another family member. So ADEC decided they wanted to run some sort of programs for them, got some funding, and then I came along to work with them to design the programs, but also do the evaluation for them as well. So you could see there, that's a real photo. I took that one. That was, they ran a swim program of women who had never swum before and often came from communities where they would have liked to have swum, often came from islands themselves, but never got the skills to swim. So that was what ADEC did, was it worked with groups to see what they wanted to run, what they wanted themselves to be engaged in. So the overall aim of the project was to reduce social isolation for these women, because often they had no other networks. They had no other people to work with, to talk to do things with. Often they were newly arrived refugees, so Korean refugees, asylum seekers, Vietnamese, So they were often very much isolated, which led to things like depression, mental health issues as well for them as well as carers. So they wanted to use physical activity as a way to get them engaged in the community, but also physically more active so that they can continue caring for their loved ones. Because if they were better, they could do caring better for their individuals. And then I did the evaluation. This one was a really great study. With all qualitative study, you often have to really develop a trust relationship. And with this particular one, I often went in and just participated as a participant for a number of the programs. So I went along to the yoga program, I went along to the swim program, I went along to their Bollywood program, and a number of other programs, their gym program, and basically participated for about 3 or 4 weeks with these women and their facilitators to gain their trust so that they can actually feel comfortable talking to me openly about what they were experiencing. Because remember, some of the things that they're experiencing, they're not just going to be happy to tell anyone. So you really had to develop that trust. So you can see there was 120 women that I spoke to. They were in a number of different backgrounds. So Afghan, Chinese, Ethiopian, Filipino, Greek, Indian, Korean, South Sudanese, Sri Lankan, Syrian, and Vietnamese backgrounds. The other interesting thing with this particular study was I don't speak all those languages, obviously. So these people, again, didn't speak English, was not their first language. So I had to work with a language translator, which I had to work with, get to know, again, develop that trust as well, that they were going to do the facilitation and give me the right information back and forth. So there was a lot of work to be done there. And so I used the translator. I did all focus groups because, again, it was that importance of making sure that they trusted someone right through. And I went, and it was lots of fun as well. I mean, it was one of those research projects that often I was going into and getting lots of hugs and hellos and, oh, are you swimming with us today? And I'd be like, no, I'm watching you today. You know, and they're like, oh, what are you watching us for? And I'll tell them. And so we would have lots of banter and lots of talks because of that trust as well. And so then what I also did was another thing that I did was these women went to these programs once a week for 12 weeks. But of course, in between, what were they doing? I don't know. I didn't know. So what I did was I used what's called photo voice. Has anyone used photo voice before? So basically, it's a new thing with mobile phones now. So I gave them a couple of questions. I told them what they needed to do with their mobile phones, and they took photos in between me talking to them in their focus groups. I asked them to take photos of what stopped them or allowed them to participate in physical activity. So I got things like, you know, something like that might have stopped them was housework. So they'll take a photo of that and they would record that, and we would see how many times during the week in between me seeing them, how many times did that stop them. And it also gave me a point of reference to talk to them about what was happening in between. Why were they only going to the gym on a Monday that ADEC was running it, but they're not going again? What were some of those barriers to getting there? Okay, so there was that in between sort of me coming in as well and getting them to do photo voice. They actually loved that photo voice component. I got so many photos that they kept sending me to the one database that I had set up that Envivo got overloaded with the analysis, you know, but lots of photos, lots of discussion. It was more when, because it was a phenomenological study, it was really just hearing their stories. It was going in there, and that's what the study does. It just listens to their stories, allows them to tell their stories in their own way, and then you create meaning from that, find out what's important, then keep talking about that. Oh, so you talked about taking your dog for a walk. How many times do you do that a week? Oh, every day. Well, you know, that's keeping physically active. I didn't think about that. So all those discussions were going on with these women to say, that's great that you're doing things. And then they'll talk about, well, I gardened. And I said, well, that's great. How long did you garden for? So it was because their perception of physical activity was very different to what they were thinking about should be happening. So we talked about that as well. I also interviewed 45 service providers, so people in gyms, at leisure centres, at sport clubs, where these women were running some of the programs, and also the group facilitators of ADEC as well, to get their understanding about, you know, what was happening behind the scenes as well. And then I did the analysis in vivo. Now I'm conscious of time. So some findings, some great quotes there. We had some enablers and then some barriers as well. Some of the enablers around health and well-being. These were some of the things that we found. So you could see there, first time that they did some of these activities, some of the things made them feel really great, because you could even see there, they got less medication because they were actually doing something like yoga for their blood pressure. So because they were doing yoga, it helped them calm down. And even though they were caring and it was stressful, by doing yoga helped them. And so their doctor reduced their medication. So there was health benefits. Again, you know, being more motivated to get off the couch, even if it's just walking each day. So we talked about that you don't necessarily have to go to the gym or to some of these organised programs. You could do things like gardening. You could do things like walking your dog. You could do things like going for a walk with the person you're caring for. But just getting out of the house and doing something different is really important. So that was one of the things we found. We also found that their skills and sense of achievement really was a really big impact. So swimming was one of them. You know, some of them had never swum before, but had young kids and wanted to go and enjoy the pool or the beach with them, but they weren't confident to do that. They also felt more confident. There was a self-defense class, and also they did disclose that sometimes when they were caring for some of their loved ones, they often would lash out at them because they had different sort of mental health issues. So they're like, by doing the self-defense training, help them be more assertive and feel good about themselves as well. So even though this was about physical activity, it had those other aspects that came into play as well, about making them feel that they were developing a skill that was helping them long term. Conscious of time, so I'm going to go through quickly. Social interaction for these particular women was really, really important, because remember, right at the start, I said one of the biggest issues for this particular cohort was social isolation. And so they often felt that they had no one else to talk to, because often they didn't have other family. They often didn't, you know, had recently migrated or become, you know, just come to Australia. So they didn't have networks themselves. So it was really important. I really love the last quote, that they can ring any one of those ladies and just have a chat, ask a question if they have, you know, and often a lot of them, sorry, I should have said right at the front. So those groups, the program was facilitated, say it was for the Italian group, they were all Italian in that group, or they were all Karen in the other group that was doing tennis, so that they got to know other people from similar backgrounds that were also caring in their communities. Okay. Some other findings, again, another enabler was support. What we did find, and again, you could see that photo, we have all been in a gym, but the women who were there were from an Arabic background, and they said, we love that we can go to the gym now dressed as how we are, because we have the support. You know, they never felt comfortable going because they thought they had to wear lycra. And you can imagine that could be a barrier for someone as well to go to a gym. So, you know, the other thing that we found was that because often these ladies didn't have transport, didn't have a lot of financial backing as well, that ADEC running the program, it was a free program, and they had a bus that picked them up from a central train stop or bus stop or somewhere to get them to a program as well. So all those supports were really important for them to go through, and often stuff that we probably don't think about when we're running those particular programs. Some of the barriers I've put there. So access barriers were all, you know, a big issue, like language. Everything's in English. Some of these people, or most of them, have very little understanding of English. So how would they find out if there was a program that they could join? Okay. Social cultural barriers, again, family responsibilities, culturally embedded priorities. So again, sort of that gendered, male and female gendered responsibilities and priorities, resources, interpersonal around confidence and interpersonal networks. And then that psychological barrier was really big as well around health and age. You know, I can't go to a gym if I'm age 60. That's just not what we do in our culture. They were the sort of comments I got from some of the ladies. So I guess there's some quotes there. You could see there. Happy to share those later. But so I was able to get a paper from this as well, which was great. I decided to put it on open access so that lots of organisations can access it as well, rather than just academics. And then what I'm currently doing with ADEC is actually developing promotional material to actually put in sport and recreation organisations about how to work with women who come from a CALD background and might be carers. So we're putting all those sort of things together. I'm also, as I said, that website, that's why I put it up earlier. I'm now developing some training modules and programs to add onto that website around working with women carers as well. So there, you know, some more stuff to go up there. And then, of course, some supported language specific information around health checkups and things like that, that will allow those women who perhaps don't have the means to go to a doctor or anywhere like that, that they can get some of the information freely from ADEC as well. So that's the next process. Now I'm conscious of the time, so I might just skip the next one and just talk about, these are my current projects that I'm currently working on. One that I'm really excited about is the Equity at Work one that has just come through. It was a competitive tender, and myself and a team from Public Health here at La Trobe got that just about a month ago, and we're going to be evaluating a program that enables people from neurodivergent backgrounds and work in government departments about how their supports have gone. Have they been good, bad, or otherwise? And then another consulting project that I'm currently working on is at Hockey Victoria down the Surf Coast, looking at their governance structure. And then my mixed method ones, so as I said, then it's not all qualitative, are the next two, which is one that I got with Julia Welsh, who used to work here, from the International Olympic Committee, and we're looking at the experiences of violence in sport across 8 countries. And then one that I'm currently trying to finish a paper on is intervention strategies around vaping for young people, and looking at sort of the black market and where that's gone now, because we've sort of taken, you know, that approach. So I think I might leave it there because that's lots of speaking from me. Happy to open it up to any questions.